Hello, everyone. Today we are going to review several ethical principles. The first principle we are in moving forward. Next, the principle of not. So let's talk about some. If people in the field are, the principle of justice refers to the. Let's go over some concrete examples. In moving to our last episode, some concrete ideas. In leaving you with this final ethical principle.
Good morning, Mr. and Mrs. Radford. I see here from your chart today that you're here today for a follow-up visit. Is that correct?
Yes, we were here about 3 months ago. Her memory loss was getting worse, and she seemed to be experiencing some weakness. So we came in. The other doctor, she was very nice and all that. She changed her diet. And then during that visit, we were there almost all day, but she put her on some IV fluids and that kind of thing. She seemed to be getting better, but since that time, she's getting progressively worse.
How are you doing today, Mrs. Radford?
I think I'm good. Everyone tells me I'm forgetting things. I think I'm getting old.
You're not getting old. She's having trouble remembering things. It's just more and more. She doesn't know people's names anymore. People she's known for years. What she's doing, where she's going. It's just she forgets where she puts her car keys. What she's had for breakfast that day.
Mm-hmm.
We've been married 35 years. Our kids are grown now, but I'm very worried about her, and so our children are concerned what we can do.
Can you tell me when you all first noticed the change and the forgetfulness?
I would say probably about a year ago was when it started, somewhere around here. But like I said, the last 3 months it's just happening more and more often. She went to the mall the other day and forgot where she was, didn't even know where she was.
Mm-hmm.
Our neighbor found her one day just wandering in the park. She didn't know how to get home. I'm afraid to leave her alone. What if she gets out somewhere and she has these episodes and she can't get home and no one can help her because she doesn't even know her name? I can't leave her alone anymore.
I understand that, and I see when you came in to see her 3 months ago, Mrs. Radford, there were concerns about your memory loss, and we ran some blood tests and some cognitive tests to kind of evaluate your memory loss, your cognitive abilities, and during that time, we used artificial intelligence, or AI, to help us to evaluate those test results more accurately. And at that time, it did seem like your electrolytes were low, and that's when we adjusted with the fluids and with the diet changes. But it seems now that Mrs. Redford may be experiencing signs and symptoms of something a little bit more than low electrolytes.
So what do you mean, Doc? Tell me straight, what's going on here?
Unfortunately, it means that your wife's condition has worsened since we saw her 3 months ago. But we're going to get it right. Don't worry. We're going to conduct some more tests to confirm and to determine the extent of the progression. And we're going to get a new treatment plan.
I'm confused. What's happening?
What does this mean?
So, Mr. Redford, I want to be completely honest with you and Ms. Redford. 3 months ago, the lab showed that Ms. Redford was experiencing these low electrolytes, and we managed that with the fluids and the diet. It seems that there were early signs of dementia or Alzheimer's that were missed. And it appears that some of those important details related to Mrs. Redford's condition were overlooked by the AI system. And I take full responsibility for that, and I am sorry.
So the machine was wrong?
Sometimes when we use these new diagnostic tools, some of the conditions can be difficult to diagnose at those early stages, especially when the symptoms become more apparent and more visible, as you've recently seen. But we are going to get it right. I don't want you to worry.
So you're saying the machine was wrong. You're saying that you got it wrong. You are depending on a machine to help you with the diagnosis. Are we guinea pigs here? What's going on? This is unacceptable. If you or the machine got it right 3 months ago, we wouldn't be here right now. Do you understand that?
I do understand that, Mr. Redford, and I understand your frustration. Alzheimer's is complex, which may make it difficult for the AI system that we use to help us to identify all the relevant factors and contribute to the diagnosis. And again, I want to just let you know that this is a new diagnostic tool that some research shows is more accurate for white patients than patients of color. But we're developing new testing and things to help us to correct this. I just want to let you know that again, I'm very sorry that this happened.
So what do we do now? She had some blood work done earlier today when we were here. They ran some tests. What do those tests tell them? What is that? Do we have the results of that yet? Do we know? Anything we can do to get her memory back.
I understand. And I'm looking here, her symptoms, the cognitive test, and her blood work we did this morning does look like what we call dementia. And dementia, in simple terms, is a condition that affects a person's memory, thinking, ability to perform everyday tasks. I would describe it like a foggy mind, which is like it's hard to remember things, make decisions, or to even recognize familiar people and places, kind of like what you've been experiencing. But again, I wouldn't worry. We want to perform more tests so we can get this right. And we want to make sure that we want to confirm what is going on and see if it is indeed Alzheimer's.
I just want her to get better.
Yes, I do too. And that's why we're going to get it right. I will get these tests scheduled, and I'll provide you with some strategies to help her to experience quality of life and to slow the progression of the disease. I would like to have you also to see a neurologist to confirm if it is Alzheimer's. Do you all have any additional questions for me?
Thank you, doctor. We appreciate your help.
Yes, you're very welcome. Anything, if you leave here and you realize that you have more questions, please don't hesitate to contact us.
No questions right now.
Okay.